Welcome to today's topic, in which we will be discussing pre-test, post-test comparison group designs. What is pre-test, post-test comparison group designs, you ask? It is a randomized experimental design that is often used for evaluating clinical research. Participants are gathered, and before testing they are randomly assigned to groups or conditions. This important feature of randomization is what differentiates itself from quasi-experiments. A simple example would include two groups, one consisting of a treatment group and the other of a comparison group. The groups are then tested before and after the intervention. It is not uncommon to have 3 levels of treatment, which would be 2 different treatments and a control group. Let's take a look at an example of what a pre-test, post-test comparison group design would look like. Lupus is a disease that affects 1.5 million people in the U.S. It affects the immune system and can affect any organ. Lupus symptoms consist of joint pain, fever, rashes, and debilitating fatigue. There is no cure, but rather treatments to suppress symptoms. Prednisone is a steroid that is commonly used to treat these symptoms but can also cause horrible side effects. Rituxan is a treatment that has been seen as another possible treatment option, although there is very few studies. Since fatigue is a common symptom among lupus patients, we will test the intervention to see if it works on lowering fatigue levels. In this pre-test, post-test comparison group study, we would gather 40 lupus patients and randomly assign them into 2 groups of 20 patients each. One group will receive the common treatment of the prednisone, while the other will receive the new treatment of the rituxan. There will then be a pre-test before the intervention and a post-test after the intervention. The pre- and post-test would be recorded 6 months apart. This will allow us to see where they were on the fatigue levels before and after the intervention. This study would be an example of what a pre-test, post-test comparison group design looks like. Now that we have our data, how will we analyze it? The analysis for the intervention will be selected by the number of levels of independent variables as well as the scale of measurement of dependent variables. For those with 2 levels of treatment and 2 levels of time, we can use analysis of pre-test, post-test within each group, analysis of pre-test, post-test score separately, gain score, mixed analysis of variance, and ANCOVA using a multiple regression approach. We must also take note that the pre-test, post-test within each group analysis is not recommended. For analysis of an intervention with more than 2 levels of the treatment variable, the post-test only, gain score approach, and ANCOVA approach, the multiple regression would be utilized with some specific criteria. When data is ordinal and not normally distributed or nominal, it is important to use non-parametric analysis. A gain approach will be used with ordinal data, a Mann-Whitney U with just 2 conditions, and a Kruskal-Wallis would be used for more than 2 conditions. Now let's talk about effect size for the pre-test, post-test comparison group design. The Hedges G from the D family is the most commonly used effect size index for this design. There is some debate about the best method to compute D for this design, but the most common method is to use the post-test measures collected from the groups. Let's review what we have learned about pre-test, post-test comparison group designs. Remember that random assignment in the pre-test, post-test comparison group design is what separates this design from non-equivalent, non-randomized group designs. We can conclude that there are numerous ways of analysis of the pre-test, post-test group comparison design depending on the variables, but the ANCOVA by multiple regression approach is considered the most powerful because there is less variability due to error. Hope this helps clarify what pre-test, post-test comparison group designs are. Thank you all for listening.